What's up, guys? So today we're going to talk to you about OTA salary, and this can be really confusing. There's a lot of information out there. A lot of the sources I'm going to share with you are just from the Bureau of Labor Statistics. So these are this information is kind of coming from the census, but there's just a lot of misinformation, and that information can also be a little bit skewing. And the reason for that is because a lot of it's based off cities with like higher populations. OT salary in general can just vary because there's so many different variables. There's people that work in different settings that are going to get paid higher or lower based on the setting that they work in. It can be variable depending on the state in which they work. Another variable can just be like the location if they're like in a more rural setting in a state. So there's just so many different things to look at. But in general, most OTAs, the average salary is going to be around like in the 50,000 range. But if you go to bls.gov, I think this is kind of a good estimate that you can just kind of look at. The median range for bls.gov is around 60,000 a year. So that's around $30 an hour. And I would say in general, that's what you can kind of expect, but you can make from as low as about $25 an hour and as high as $85,000 an hour. But most people aren't going to be on this high end unless you live in a state that pays a lot more like California. But in California, you're also going to have like a way higher cost of living. So there's just a lot of variables. There's a lot of things to consider. Another variable is going to be how long have you worked at the location? Have you been an OT for 5 years? Have you been an OT for 10 years? Are you a new grad that doesn't have any experience at all? And so there's just a lot to consider. And then the other thing to consider is, are you working full-time? Are you working part-time? Or are you working per diem? If you're working per diem, a lot of times you can make a lot more money, like these people that have been working in their career for maybe like 10 years or 15 years. Per diem just in general pays a lot more because you're not getting those benefits. You're not getting a lot of the perks that full-time employees get, like paid time off. So your salary, you can actually have a much higher rate. And then you're also saying that you're a lot more flexible in your job. If like census is low, you're willing to take the call off. So there's a lot of just variabilities in just working per diem. I think this is just totally packed with a lot of information. What is OTA salary? Well, it really depends on so many different things. So that's what I'm just going to talk to you a little bit about today, just so you have a better idea going forward on what you can expect working as an OTA. Okay, first off, let's just talk about what state pays the best. So in general, for OTAs, I'm going to say that California pays the best. Now, as an occupational therapist myself, I've worked in Nevada for a number of years. I would actually say that Nevada pays the best for like occupational therapists, but for some reason it doesn't pay as well for OTAs. And I currently work in California right now, and I was making a whole lot more working in Nevada than I'm currently making in California. So I'm going to say that Nevada is probably the highest paying state, and second is going to be California or Texas, around there. And that's just for occupational therapists. Now for OTAs, the highest paying state is going to be California's pretty much number one, and there could be some variables to that. And then number two is probably going to be like New Jersey or Texas. And I'm getting a lot of this just from bls.gov. So how much do OTs get paid in California? So the average is going to be about $80,000 a year, or around $40 an hour. The next highest paying state is going to be New Jersey, on the opposite side of the coast, which in New Jersey they make about $77,000 per year. And then Texas is going to be around $74,000 a year. Just to kind of give you an estimate, those are the top three paying states for OTAs. Now, if California is paying like $38 an hour for OTAs, what can you expect in other states? So I would expect in Florida, you could probably get around $30 an hour. In Tennessee, you could probably get $30 an hour. In Nevada, I know OTs that were making $30 to $35 an hour. So that's something you can expect there. So that just kind of gives you a general idea around the U.S. States that are going to pay a lot lower are going to be your northern states like Idaho, Montana, the states with just a lot of area and a lot less people in them. The Dakotas, those aren't going to pay well. Washington, Oregon, they're going to pay around the same. It's probably going to be around $28 to $32 an hour. Texas is going to be on the higher end. South Carolina, North Carolina are going to be about the same. I'm going to say $28 to $30 an hour in general, okay? But it also really depends on the setting you're working in, right? So if you're working in a skilled nursing facility, it's going to pay a whole lot more than if you're working with pediatric population. So that's something you should definitely consider. It's not about what state or city you work in. It's about the population that you're working with and also what position you're working in, full-time or per diem or part-time. Okay, next up, what are the top cities to work in? So as an OT, I currently work in San Luis Obispo. I've worked in Las Vegas in the past. Las Vegas pays way more than where I'm working currently. Bigger city, there's a lot more hospitals, so there's gonna be a lot more competition there. So if you work in a bigger city, you're gonna have a little bit more advantage just because bigger cities, that means more population. It's just a little bit better for OTs in general to work in a big city. Unless you work in like an area where there's no OTs at all and they're super desperate and they're willing to pay like top pay for OTs working in that area. And the easiest way to do this is just to be a traveler or to be a contract therapist and maybe travel to this area to provide OTA services. That's just another way to make more money as an OT for these communities where there's just not as many therapists working. All right, what about cities? What's the highest paying city for OTAs? The highest paying city is definitely going to be San Francisco, but the cost of living is going to be ridiculous. And I'm going to say for most OTAs, unless you can live with someone for free or you don't have to pay rent, San Francisco is not going to really be affordable, and the pay isn't really worth it unless you have some other way to subsidize your income. San Francisco, highest paying, and then pretty much anywhere in the Bay Area. So if you're working in Oakland, if you're working in Sunnyvale, if you're working in Santa Clara, you can make anywhere up to $92,000 to $94,000 as an OT in those areas. Those are the averages. And then next to the Bay Area is going to be like San Diego, but the pay is going to drop about $5,000. So you can expect to get paid around $85,000 in a year in San Diego. But who can afford to live there? Now, if you have dual incomes, I mean, you might be able to afford to live there. It probably won't be as big of a deal. Next up is going to be like Modesto, California, or Bakersfield. I know a lot of people don't live in California, but I'm just saying like these are the top places, top cities to work in. You can plan on getting around $80,000 to $83,000 a year. And those are a lot more affordable cities to live in as well. And the next highest paying city outside of California is going to be Texas, in Austin, Texas, where you can get up to $79,000 a year, like your average OT salary. So that's just to give you just a rough estimate on what are the top paying cities. From my experience working with OTAs that worked in Las Vegas, you can expect to get around $35 an hour or $70,000 a year if you're working in those higher settings like skilled nursing facility or acute rehab or hospitals. All right, now on to what are the top paying settings for OTAs. So this can vary quite a bit. When I worked in Las Vegas, I would say that skilled nursing facilities and hospitals are probably the top paying for OTAs. But in other states, this can change quite a bit. And it's really weird because according to BLS.gov, the top paying area is actually home health. And I kind of understand this a little bit, but I just don't like home health as much because it appears to pay more, but in reality, with all the time that you put in my experience, it really doesn't pay as well. So I would not say, in my opinion, that home health is the top paying, even though that's what it is saying according to the statistics. So I would say the top paying is going to be acute rehab, skilled nursing facility, and hospitals. I wouldn't say they're necessarily in that order. In my experience, it's always hospitals that pay more because hospitals have the most money. But a lot of times it's hard to get jobs for OTAs in hospitals. Hospitals just don't tend to hire OTAs because they want you to be able to do more evaluations, and they're constantly pumping out evaluations, and they want you to have that skill level to be able to do them. And hiring and the time training an OTA for some hospitals just isn't worth it. I currently work at a hospital where they don't hire OTAs. I've worked at hospitals in the past where they don't hire OTAs. It just seems like they continue to hire OTs in general, and they just don't have the time or resources, and they don't want to spend the money in all that training. I don't know exactly the reasons why, but they want more skill level. They want you to be able to do evaluations, which OTAs are only able to provide the treatments. Okay, so those are the top paying settings, but there's one other setting that I've kind of overlooked a little bit, and that is the highest paid position as an OTA, and that is going to be an OTA that isn't just doing their job at a hospital or a skilled nursing facility. It's an OTA who started their own business. Okay, so this is going to be top tier level, and that's because they decided they wanted to start an outpatient clinic, or they wanted to get involved in an acute rehab. Maybe they're working in a leadership position at a hospital, and they've kind of ignored the traditional role of just seeing patients day to day and doing treatments. They're working at this elite level, which is just starting a business. And I would actually recommend this. If you are an OTA, or if you're on the path of an OTA, I'd highly recommend becoming a businessman. Figure out what your passion is and go for it. Whether that's outpatient, it's pediatrics, just start a business. I've worked as an OT for 10 years, and I've really kind of felt the burnout working for someone. And I feel like it's so much more meaningful when you have a job when you're working for yourself. So that could be starting a clinic, that could be starting a home health agency, that could be just starting a business for pediatrics. There's so many different things that you can do. You could even do stuff in your area, like you could do driver rehab. You can do ergonomics assessments. These are jobs where you can actually do evaluations and assessments, and you don't have to be an OT, and they can pay a whole lot more. So if you become an OTA, you have all this experience in the profession, and then you decide that you want to become certified in ergonomics, well, you can start doing evaluations and assessments. And that's something that you can't do as an OTA working in a skilled nursing facility or a hospital. You can never do an evaluation or assessment because you're not an OT. But as an OTA, you can move up the field. You can start doing things on your own. You can start evaluating people when you're working in these other types of settings like ergonomics or driver rehab. Because both those settings don't require certification. It doesn't require that you are an OT or a PT, or you can work pretty much in any discipline and become an ergonomic specialist. All you need behind your name is a certification, or you don't even need that. You can just work in these professions based on your own research and knowledge. So that's just another setting that you can work in this field of OT and not have to be limited to what your job allows you to do. Okay, the last thing to talk about is how to find out how much OTAs get paid in your area. And I think this is really key behind everything I've said today, because it really depends on what you want to do, right? So if you want to work in pediatrics, you need to start contacting pediatric OTs in your area on Instagram, on Facebook, on any social media site. You could even go on YouTube, but you're probably the best bet is like go on Instagram, or just like find a clinic where there's an OT. The easiest way to do this is like find a private practice clinic. Just email the OT, or maybe call them and say, hey, I'd like to ask the OT a few questions. They can give you their phone number or their email address, and then just like straight up ask them, like, I'm interested in working here or becoming an OT or whatever, and say, what can I expect starting out? Just start contacting local OTAs in your area, and that's going to give you like a way better idea of what people are making in the area that you want to work in, rather than relying on all these statistics online. For me, what I do in my job is I'll just work with a lot of different disciplines, and I'll just straight out ask them after I feel comfortable with them. After a period of time, I'll just be like, hey, what is your pay at this job? I don't usually ask them what they're currently getting paid in their position, because that's, people don't usually talk about that. But if they work home health, I'll usually just ask them like, hey, what does your home health company pay? I'm interested in working there. Or what does your job in pediatrics pay, like starting out? It's just like a super easy way to ask people, and a lot of people will just share that information with you. That's the easiest way to do it. Just like start asking. Go on Instagram, ask people in your local area what they're getting paid, call people at their jobs, find a mentor and start shadowing them if you are interested in OT, if you're a beginner OT. And then after you worked with them for a little while, like ask them like, what can I expect to start off working in this type of setting? And then if you are shadowing like at a rehab or a hospital or whatever, like ask the people that you're shadowing with. I would say shadow as many professionals as you can, like shadow OTs and PTs, and then just ask them like, what can I expect to get paid in this field? And that's going to give you a rough estimate of what you can expect if you work in that same setting. So, and the thing that's cool too is if you're working with OTAs or PTAs, like they're pretty much making the same amount if they're working in the same setting. So that's just a kind of an easy way to figure out how much you can get paid. All right, guys. So I hope this was helpful. I hope I didn't overwhelm you with any of this stuff. But yeah, it's super confusing. There's a lot of information out there, and the easiest way to do it is just to start asking people in the area that you want to work in. And also ask, like, based on, are they working full-time or part-time or per diem? And I'll put a link in the description below that talks about OT salary in general. And also share your thoughts in the comments below. This is a really small channel, so if you share your thoughts, most likely I will respond to them pretty quickly. So share your thoughts and let me know what you think about OTA salary. All right, guys, I hope you enjoyed this video. Please like, subscribe, and I'll see you in the next one. And I hope you have a great day.